Good day, everyone. So today we're going to discuss another registered nurse, an adult nurse, who's been struck from the register this year, 2021, who will remain anonymous. Well, on this channel anyway. So, the charges levied against this adult nurse: failed to administer enoxaparin at the following times. Enoxaparin is a heparin drug which is used to thin the blood. It's usually for people that are at risk of developing clots, usually due to immobility, but can be for other reasons. You'd have to refer to maybe a more medical channel for that. So here, 2 days on the trot hasn't been administered. It's usually administered subcutaneously, usually in the belly, just getting into the sort of subcutaneous fat, and the heparin will help reduce the risk of clots for someone who's sort of remaining in bed, limited movement. And so the risks of not administering enoxaparin are huge. They could have a clot and die. In my own experience, I've seen a patient with a pulmonary embolism. We had to do CPR on them, so it's really, really serious. It can kill. It does kill. So missing that is just unacceptable. Unacceptable. Especially 2 days in a row. So you've essentially opened that chart twice, both times, and you've missed it. So it's not just a one-off. Incorrectly signed the chart to say it had been administered. Oh wow, okay, and then lied about it. Okay, and then there's another patient, a second patient that was also on it on the same days, and also lied about that as well. And again, on a third day on the trot now in regards to another patient, and incorrectly signed the medication chart to indicate that it had been administered. So that's really, really serious. Unfortunately, so the person's written in and they've basically said they don't want to be a nurse anymore. So I'll read out quickly what they wrote. Since the hearing, I have left nursing and am working in the hospitality industry as a blank blank for a blank company. I am undergoing management courses and increasing my portfolio. My reason behind my decision not to return to nursing is mainly based on the experiences I had with blank hospital, and this being the main hospital in the blank area where my godchildren and friends are based. My confidence and passion for nursing has been knocked following the lack of support within the trust and the conditions of working leading up to the incidents investigated by the NMC. Talking to friends I trained with, these conditions are getting worse rather than better. I am deeply saddened that this is my decision, as my experiences in blank hospital, where I gained my Nurse of the Year award, were some of the best experiences of my life. I am unsure whether I would want to return in the future, and this is based on the fact I feel in the current climate with COVID I have a lot to offer. However, I appreciate the NMC requires a definite answer. So that was quite a sensible note that was given in. A lot of other people that write things in, a lot of them can be one-liners in, I'm not coming, I don't want to be a nurse anymore. But it seems to have articulated himself quite well. Although I'm not sure what he means. I mean, failing to administer twice, giving blood thinners to people who are at risk of clots, it's got to be up there on the priorities list, unless you're doing CPR or something else to that level of extreme. I just can't think of another reason why, or another thing which could distract you to the point where you would prioritize that over giving these. It would have been better to give it late. It was prescribed at 10 o'clock, okay? He's given it at 11 o'clock. They've had it. The risks of having a clot are mitigated. They could give it a little bit later the next night, perhaps. Give it at 10:30 the night after. or give it a 10, take some medical advice. But just to not give it, and then to lie about it, I mean, this is where he's come unstuck. Now, if he'd have just said, I forgot, I'm really sorry, sort of engaged that kind of duty of candor, or maybe written some letters of apology to the patients, explained what happened, why it was missed, then perhaps they would not have looked at striking you off. But saying you're leaving the profession anyway, it's not really gonna... That's as good as no insight, really. They want reflective pieces and evidence that you've moved on from that, and you're... But with the dishonest element, unfortunately, not going to work out. So, yeah, it's put people's lives in danger. Alright, well, thanks for sitting through this one with me. Until next time.